I am thrilled to be here with you today. My name is Dr. Mona Sadikpour. I am co-directing this session with my colleague and friend, Dr. Jennifer McGregor, who's going to speak to you and give you all her wisdom in just a few minutes. And welcome to the skin tightening and body lifting session this morning. I'm actually a dermatologist, fellowship trained. I'm in the process of moving from Denver, Colorado, where I had my own practice. I actually started my career in academics, and during the pandemic, opened up a practice. And we decided that we wanted to be closer to family, so we just ended up moving to Pittsburgh, Pennsylvania, which is where I am at now, and will be hopefully for the foreseeable future. So what I'm going to be talking to you about, sorry, can we go back one slide? I clicked too soon. Thanks. So what I'm going to be talking to you about is challenges in the skin tightening market, because we all want tighter skin, but we can't all have it. Here are my disclosures. Now, why are we talking about skin tightening today? It's because skin tightening is hot. Just get on TikTok or Instagram and you'll see different people asking for it, wanting it, showing you where they're getting it done, different people giving opinions on what works and what doesn't work, and that's exactly the reason we're here today, just to tell you what works and what doesn't work. And the reason for this, especially during the pandemic and the post-pandemic era, patients are really focusing on the thing that they can see in the mirror or on their cell phones or on their selfies, and this tends to be the face and neck. So they notice that their skin is getting looser or it's slightly sunken in, and they come to us asking for help. In fact, the American Society of Plastic Surgery collects data every single year on what are the most popular procedures. And in 2022, facelift was actually the second most common plastic surgery procedure after blepharoplasty. And over 400,000 non-invasive skin tightening procedures were performed in 2022, according to ASPS. So why is meeting this demand so difficult? It's a great thing, right? We have lots of patients. They want skin tightening. We should be really, really excited. But we all kind of get a little bit scared when people ask about skin tightening. And the reason for it is because our patients are incredibly heterogeneous. Some come and they want this. We all have seen that. Others come and they're pulling their neck. So those are two different areas. We may be doing different things on the face and neck. Other ones come and they lift their shirt because they want skin tightening on their body. So that's a different anatomical area. You may be using different device for that. Other people, you may say, listen, you're going to need more than what I can just do for you in the office. And maybe they're a surgical candidate. Other people are younger and they're looking for non-invasive procedures to keep their skin looking tight and lifted and beautiful. So that may be a different thing than the picture that I just showed you. So the point being that the patients are heterogeneous. The anatomical locations are different. Different skin on different parts of the body may or may not respond differently. And it's our job to be able to meet all of this demand for all of our patients. So not only that, but physiologically and biologically, lifting the skin is really hard work. So again, going back to the patient population, we know that some are going to be surgical candidates, and budget is a huge issue. We're hearing about facelifts that are costing $250,000 a year. Not everyone is going to be able to afford that, and not everyone is a candidate for that. Other people may just think that, $5,000 is not a big deal. Other people may say, listen, there is no way I can afford that, so budget is an issue. But most importantly, not everybody has the appropriate expectation. Everyone wants things to look natural, but they want it to be fast and they want it to hopefully not cost that much, and that's going to be a really hard thing for us to meet. And the other important thing is that non-surgical device market is saturated with different products, different names. Just take a walk down the main entry today and you're going to see all these different names, some of which have really exotic names and feminine names. And the truth is that even for us who are on top of this field, or we're thinking that we're trying to keep up to date with everything, it's hard to keep up. And we can't always know what's the best thing out there because a new thing is coming out every day. But let's not forget, for us, devices are also expensive. We can't buy everything. We can't have everything in our office. And particularly with skin tightening procedures, again, I talked about this being physiologically a hard process to try to induce in the body. And part of that reason, the procedures take a long time. So who does it? Should we delegate? Should we not delegate? And after you've done all of that and you've brought the devices into your practice and you're really excited, you talk to patients about it and you show them before and after photos and they're like, I don't know about that. So patient buy-in for not just initiating treatment, but continuing treatment can be hard as results we know take time and can be subtle. So again, so many options, so little time. You're going to hear about some of these devices, and it's just really hard to keep up. But not only that, but what does it mean to have skin laxity? Everyone wants tighter or younger skin, but what does that mean and what do they really want? Because someone who has skin quality degradation issues may actually benefit from a resurfacing technique or something that doesn't fall under the category of skin tightening devices. And this may include, superficial iridities, and they may think that they want skin tightening, but what they actually need is something different. They need good skincare, they need resurfacing, and they may not need some of the devices that we're going to talk about today. And this because as we get older, there's diminution and degradation of the matrix structural support, such as collagen and elastin. For other people, it's not that. It's actually fat loss. They're getting older, maybe they're runners, and they are losing fat in their skin, both the superficial and deep fat pads. So how do you address that? And maybe the skin tightening procedure that you just spent $100,000 buying is not going to address that. So what do you do? There's bony resorption and migration, we know that, and that leads to gravitational downfall of the skin. But the point is that all of these different physiologic events that happen as we age can create the perception and experience of having older, more lax skin. And it's our job as physicians to fix it. But each of those things require different strategies and different tools to create the best outcomes. And that's what we want to do as dermatologic surgeons, is to give people the best outcome. So some points to consider in assessment. Again, we're going to kind of talk about this. Again, are you actually looking at excess adipose tissue or skin laxity? Some people come and they touch their submentum and say, I want this gone. And they think it's a fat issue and they're trying to look for cool sculpting or maybe Kybella. But when you actually take a look, there is no adipose tissue there and it's pure skin laxity. So you got to talk to them about that. What are patients' goals? What are their budgets? What's their tolerance for downtime? Because you don't want someone who is unhappy after they got a procedure that gives them 2 to 3 weeks of downtime. So the first decision tree for us as doctors is to determine, is this a knife versus a non-invasive device patient? Okay, do I send them to my colleague or can I take care of this patient in-house? The second decision is who would do best with what device or what non-invasive modality, and that's what Dr. McGregor is going to talk to us about today. But what we all know is that combination treatments almost always render the best results. So how do we tackle? Again, we're going to talk to patients, and for those who require surgery, we know that it's effective. We know results are long-lasting, but it can be extremely expensive. Again, anywhere from potentially $50,000 to $250,000. I can't imagine that. There's lots of downtime, and it's skill dependent, but most importantly for us, not all of us do it. So we got to still be able to help our patients. For those who are not that candidate, those are still expensive procedures. Yes, there's less downtime, but perceived efficacy is all in the eye of the beholder, and that's the patient, and we can't control that. And again, most of us can't afford all the devices, and who do we use? What do we use for whom? And procedures are time consuming. So a big question always for me is, do I delegate this procedure or do I do it myself? And if I delegate it, is that going to change the efficacy? So this is a slide by Dr. James Newman, who's one of our colleagues. He was actually supposed to be here today to give you some information about, as a facial plastic surgeon, who he decides to send to the knife versus a non-invasive procedure. But one of the things he wanted me to share with you, these are the consideration of surgery for the 4 R's of rejuvenation. So repositioning, loose enveloping fat. So if you're needing to do any of the following 4, you need to consider surgery. Replacement of facial fat, removing excess skin, or redraping the skin in a vertical vector. And again, he just wanted me to emphasize to you guys, you need to consider longevity of actual facelift results or neck lift results, but there's much more significant downtime, typically 2 weeks to get back into the social environment. And this is an example of one of his patients that he thought, we should see as someone who needed to go to get surgery. Now, some of you may look at this and say, you know what, there are things in my office that I can help do, but obviously you can see that she was able to get beautiful results using the deep plane lift and eyelid surgery with repositioning, redraping, and removing excess skin.